Well, Healthy Horizons is a new regional vision that we just published. It's taken about 6 months of intensive consultation with our leading clinicians and public of the North West to sort of think hard about what we want in the North West in the next 10 years for health and healthcare. It looks back on where we've been for the last 60 years, because this year's the NHS's 60th anniversary, and we've tried to think hard about what do we want to do in the next 10 years to really improve things. And what Healthy Horizons is the manifestation of that in our documents and our websites about ideas we've got about how we can improve health and healthcare going forward. I was born and raised in Rochdale in the northwest of England, and I've been a person who's benefited enormously from the health service and now have the privilege to try and organise it. So this opportunity to think hard about how we can improve health and healthcare in the northwest is a really personal issue for me. People might ask, why do we need to change the National Health Service? It's done all right for 60 years and, in a lot of ways we're providing an excellent service. But when we look at the current problems that we face in the North West, we have some of the unhealthiest lifestyle in the country, in fact some of the unhealthiest lifestyle in Europe. Sadly, we still smoke too much and drink, unfortunately, a bit too much, and perhaps we don't exercise as much as we should. So when we're going forward, what we need to do is think about how can we change that in the North West so that fewer people need healthcare, and when they do get healthcare, the resource that we've saved there, we can really turn into an excellent service for everybody, every time, everywhere they use the health service in the North West. So what we've got to try and do is to change that dynamic so that people really only use the health service when they need to, and by trying to reduce avoidable ill health, getting people to focus on health as well as healthcare, we can really avoid having to put more and more of the taxpayers' money into the health service in the North West. One of the things we know about the health service is that people are constantly inventing new technologies, new ways of helping, new pharmaceutical interventions, new drugs, new techniques, and what we want to do is to bring that first to the North West so that if you live here you get the benefit of that new technology. So we're constantly looking to improve our services. We're already doing a lot of things very well. We've reduced our waiting times now so that by the end of this year no one will wait longer than 18 weeks. That includes the diagnostic phase before they've been referred till they get treated, and that's a real advancement on where we were 5-10 years ago when people were waiting 18 months, not 18 weeks. And that really compares very favourably with other European countries. And we've also managed our money very well, which means that when we look forward to the next 10 years, we've got resources to invest. And that's critical if we want to really change people's lives and improve the healthcare that they receive. One of the things that I would say that we excel in is working with our partners, because if we want to look at health, not just healthcare, we've got to improve our facilities, our housing, our access to leisure, and really working with our key partners in local governments, in the Regional Development Agency, we can improve the wealth of the region, the sort of social fabric of the region, and that can help us to develop a better health service. As a leader of the health service in the North West, I'm absolutely privileged to have this opportunity to work with people to improve the services that everybody gets here. And I'll be working with my colleagues to try and listen hard, to make sure that we understand what people want, and then really to try and deliver our bargain, our part of the service in terms of how that deal could work for people. Having published our plans in the Healthy Horizons document, we're very keen to keep people involved in this. So what we intend to do is we've set out 10 touchstone tests where these are measures of, are we delivering on our promises? Are we carrying on listening to you? And in those 10 touchstone tests, we'll effectively be talking to people about how we're improving the health service, and if we're slower than we'd like, then we'll have to keep up with people and their expectations. So this is going to be an ongoing process, and we're going to talk to them throughout the next 5 to 10 years in the same way as we've just talked to them for 3 months. It's not a one-off. Healthy Horizons sets out a platform for a new relationship, a new dialogue with people about health and healthcare in the North West. And what we'd really like to happen is for people to get engaged in that, to think hard about their health service, think hard about their own health, and think about how they could help us to help them. And that's what we're trying to do here. We're trying to change this dialogue that people have, make them think harder, if you like, about health, and really, really help us to improve the health service that we offer.